There's a lot of excitement right now about a new Wegovy pill for weight loss. But how well does it actually work? Who should take it? And what do you need to watch out for? As a clinical pharmacist, I'm going to walk you through what this medication really does and how to take it correctly. And the most important safety point you might not want to miss. If you're new here, I'm Lucy, a hospital clinical pharmacist, and I make health and medication videos to help you feel confident about your health. Today, we are talking about oral semaglutide, sometimes called Wegovy pill, and what you should know before starting it. Let's get started. Oral semaglutide is once daily pill approved to help adults lose weight. It works by mimicking a natural hormone in your body that helps control appetite, slow digestion, and helps you feel full longer. This medication does not work on its own. It must be combined with fewer calories and increased physical activity. I know you're asking, is this medication right for me? You may be a candidate if you have a body mass index of 30 or higher, or a BMI of 27 or higher with at least one weight-related condition, such as high blood pressure, type 2 diabetes, or high cholesterol. This is a prescription medication, so your provider will confirm if this medication is appropriate for you. Like with every medication, this medication cannot be taken by everyone. So, who cannot take this medication? You may hear warnings about thyroid cancer with this medication. So, let me clarify that briefly. In animal studies, semaglutide increased the risk of very rare thyroid cancer involving C cells. This has not been shown in humans, but because of those animal findings, people with personal or family history of medullary thyroid cancer or multiple endocrine neoplasia type 2 should not take this medication. For general population, this cancer is extremely rare. Also, you should not take oral semaglutide if you have a serious allergic reaction to semaglutide, or if you are pregnant, planning to be pregnant within 2 months, or breastfeeding. If any of these apply to you, this medication is not considered safe. Now let's talk about how to take this medication. This medication only works if taken exactly as directed. You should take it first thing in the morning on an empty stomach after an overnight fast. Swallow the pill whole with no more than half a glass, about 4 ounces of plain water. Do not crush it, do not chew it, and do not break it. Then, wait at least 30 minutes before eating, drinking anything else, or taking other medications. Taking this medication incorrectly is one of the biggest reasons you might not see results. The Wegovy pill is given in a titration schedule. The dose is increased gradually to help reduce side effects. This follows a fixed escalation schedule of about 12 weeks. Day 1 through 30, you take 1.5 milligram once daily. This is the starting dose. Day 31 through 60, you take 4 milligram once a day. Day 61 through 90, you take 9 milligram once a day. And day 91 and onwards, you take 25 milligrams once daily. The 25 milligram is the maintenance dose. If side effects occur, your doctor may slow this process or keep you at a lower dose longer. This is common and it's done for your safety and tolerance. You might be asking, how much weight should I expect to lose while taking Wegovy pill? In clinical studies, patients lost about 13 to 14% of their body weight over about 6 months. So, if you weigh 200 pounds, you would lose roughly 26 to 28 pounds. Many patients also see improvement in blood sugar, blood pressure, cholesterol, and waist size. As you know, all medications have side effects. So, what side effects do you expect to see with Wegovy pill? Most common side effects affect the stomach. Nausea is the most common side effect. You can avoid it by eating smaller meals, avoiding greasy food, and eating slowly. Also, you might experience vomiting, diarrhea, and constipation. Hydration is critical. Drink enough fluids, especially during dose increases. And eating more fiber, smaller meals, and physical activity often will improve symptoms. The good news is most side effects improve within days to weeks. The Wegovy pill also has some serious warning signs. Call your doctor immediately if you experience severe or persistent abdominal pain, ongoing vomiting or diarrhea, neck swelling with hoarseness or trouble swallowing, signs of dehydration or kidney problems, gallbladder pain, or mood changes. These side effects are uncommon but very important to recognize early. You might be asking, how long will I have to stay on this Wegovy pill? This medication is intended for long-term use. Most people regain the weight if they stop taking it. Your healthcare provider will monitor your progress, labs, and side effects over time. If you are considering weight loss medications, make sure you understand not just the benefits, but how to take them safely and correctly. If this video was helpful, like, subscribe, and check out my other medication education videos. Until next time, stay healthy and remember, health is the greatest wealth.